Okay.
If you would tell us your name and let us know how long you've been a patient with the Michigan Hematology Oncology practice.
Well, my name is Lee Ann. I don't know if you need a full name.
Leanne is
Just
fine.
Lee Ann.
Mm-hmm.
And I feel I've been a patient with this practice since March.
Okay.
And I have felt all along that in a lot of the answers to the prayers in my life have been in the doctors that have found me or I have found them.
Mm-hmm.
Dr. Justy was recommended by my surgeon at that point, and she said, I think you're going to really like her. I think you two are going to get along.
Yeah.
And we did instantly. You know, I found something very wonderful and caring in her.
Oh, that's wonderful. You know, during your treatment here, what's it been like for you? How have your interactions been with the nursing staff and the staff that you work with when you come in for treatment?
They have been very, very kind and very understanding. I have to say that when I started my chemo, I came to this facility in Clarkston
Mm-hmm.
because I liked the concept of the privacy of having a separate room where I could just do my own thing, my family could come.
Mm-hmm.
Then when I had to go back into chemotherapy this fall, for some reason I had my first appointment in Rochester, and they believe they're more in the group situation.
Mm-hmm.
And I've decided I really like that too.
Yeah.
You know, that there's a lot of great sharing and caring that goes on
Mm-hmm.
when you've got a room full of people who all are, you know, maybe at different stages, doing different treatments. Some are new to the situation, some are old to the situation. And I think that there's a lot to be said for that too. So, you know, I guess people have to make their individual choices.
Sure.
And I think my family liked the individual room much better simply because we got attached to one particular nurse,
Mm-hmm.
and they liked the privacy, and, you know, we could pack our picnic and
Mm-hmm.
bring our books and magazines and
Right.
make a day of it. But now I think they're also understanding
Mm-hmm. How it's a connection
how
for you
it's a
with
connection,
other patients.
right?
Sure.
So I think there's something to be said for both places, and I have found the staff just, you know, amazing in the care that they give, the time that they spend. I have learned a great deal from the nursing staff,
That's good to hear.
and I have to say, the office staff. I have found the office staff, I've gotten to know the staff in Rochester better, but I have found them to be very much part of the process.
Mm-hmm.
They've been very personal. They're very good about knowing my schedule, scheduling things that they know are going to work for me as far as treatment, MRI tests, things like that. So I think that they're really part of the whole picture.
I agree.
But the bottom line for me here has been Dr. Justy. When I first came here, I was stage 1. Well, actually, when I didn't come here, I started with stage 1, and the next week I was stage 2. When I became stage 3 was when I joined this practice, and Dr. Justy began the journey that was going to continue from there. And she was the one who had to come in and tell me, you know, that it was stage 4. And she was so kind, so kind. And my family laughs because they say that I like her because she pats my knee. I said, you know what? I think I did like her because she pats my knee.
Sure. She's very gentle, isn't she?
She's very kind. And we have had a spell from June, like the end of June, she gave me some semi-good news. And we've not had any good news since. You know, it's been bad news after bad news after bad news. She comes in and, you know, she's just kind of like part of our family.
Yeah.
She's very dear to us. And I just got good news for her.
Well, good. See?
So we said, hooray!
Yeah.
It took us a lot of months, but we finally got to the good news. And we felt like it was a real turning point.
Well, I'm sure she was happy to be able to share that
She was as happy as she could be.
with you. Yeah.
And so I just cannot say enough about how important she's been to us. And everybody in the family knows her. The kids know her, the cousins know her. And She's just had a wonderful way, and I have great faith in her. And the other thing I think that has been so kind about her is that she's willing to work with outside forces that we have found, she was more than willing to do the research for us as far as a program at Carmano's. We ended up not using it, but she was very happy to do that. She works with the holistic doctor I have now, and she works with, she's been very understanding about looking for his studies and other places. So I really appreciated her open-mindedness.
That's good.
Yeah, I thought that was important.
Well, thank you.
Well, you're very welcome.